This is Planning for Care for Familial Alzheimer's Disease. And today we have Vanessa Souza from the Alzheimer's Association, the California chapter and Northern Nevada chapter, and she's a senior manager. And we have Jessica, part of the panelists, speaking and sharing perspective today. Vanessa, I'm going to turn it over to you.
Thanks, Alicia. Hi, folks. Thanks for having me with you today. I'm really glad to be bringing you a little bit of information about planning for care in familial Alzheimer's disease. I think there's certainly some unique considerations that we'll talk about when we're talking about familial Alzheimer's disease versus typical aging, but even versus later onset Alzheimer's. So I'm going to share a little bit of that with you. I wanted to just think about when we're talking about care, we're talking about planning for the future, but we're also talking about like a continual process, right? Of thinking about ourselves and our families and what's important to us and what does that look like. And we're going to look at that a little bit across the legal, financial bit, but also the workplace. Do you keep working? Does your spouse, if you have a spouse, keep working? And also about how do we want to live and how is it safe to live? And we're going to hear more about lifestyle decisions and making choices and prioritizing and things like that later when we get to discuss a little bit all together. But I do want to just touch on a few things, right? For folks that have familial Alzheimer's disease, we know that there's these unique considerations. We know that for the most part, folks are going to be younger when the symptoms begin. And so that means there's less time to save for the future. We also know that in the face of a strong family history, multiple generations of the family living with Alzheimer's disease, there might not be financial generational wealth, right? Because people have used that financial situation already in the past for the previous family members. We know that a lot of the systems of care that we interact with around Alzheimer's disease are designed for seniors, right? Designed for people over 65. And so if we're younger and we're engaging with these systems, it can be hard. And folks with familial Alzheimer's disease and any kind of younger onset Alzheimer's disease are more likely to still have kids at home, or maybe kids that are in college, or that kind of boomerang time in the early 20s where they might come back home. But there's some other considerations too, some things that are perhaps strengths or resources. For example, we know that people with familial Alzheimer's disease are a big part of our clinical research in Alzheimer's disease. You are a massive part of what we know about Alzheimer's disease. And folks may already be an active participant in a clinical trial or may just be more interested in participating. You may be more likely to be in otherwise good physical health due to being younger in the early stages of displaying symptoms. And due to having that knowledge of family history and that genetic knowledge, there is increased time to plan ahead. And that's a little bit of what we're going to talk about today. And again, due to that knowledge of family history, you might be more clued in, more likely to have early detection and early intervention if symptoms do develop later on, right? There is an awareness and opportunity to make these kinds of decisions. And the first thing I want to think about with you all is legal and financial decisions. These can be difficult conversations to have, but there's some really good ways to start the discussion. I would always encourage folks to start by just writing down your goals, what you want to talk about, what items, what documents you're going to go over, and really put some thought into what is the most comfortable way, the most productive way to have this conversation. How can I have an honest conversation with my loved ones about our legal and financial situation and what we might want for the future? And it's really important to take your time and realize this doesn't have to be a one-time conversation. This does not have to be a big, fierce talk. It can be something that happens over time and as you're comfortable. Now, these are legal documents to think about either creating or updating. These are all based on the United States, but there will be an equivalent anywhere worldwide. The first thing being just a will. A lot of us create a will maybe when we get married, maybe when we have children. That's a standard thing that a lot of people have. But the things that Alicia asked me to talk about a little bit is this concept of advanced directives. And an advanced directive is a document that gives someone else the ability to make decisions for you when you no longer can make them. Most commonly, that's going to be a durable power of attorney for healthcare and what's called a living will. Again, the specific names of these things can vary from state to state and from country to country. But at the end of the day, what these are is you're appointing what's called a healthcare agent. You're appointing someone to make decisions for you in the future when you can't do it by yourself. There's also a similar durable power of attorney for finances, and that's someone to take care of things like bank accounts, property that you might own, again, when you're no longer able to do that for yourself. Any person can have an advance directive established at any point in time, and it's not something that takes until you need it to take effect. But I think a lot of the time people can hesitate. They don't want to fill out these forms because it can feel like you're giving up decision-making power, but that's actually not the case. I have my advance directives completed already. My best friend is my power of attorney for healthcare and finances, and my mom is my secondary power of attorney for healthcare and finances. And it was my birthday one year, and I was going on vacation with some girlfriends. I brought my advance directive with me, and we were just sitting down having dinner. And I said, girls, we're going to go through this paper together, and you guys are going to witness my signature. And we talked about what I would want, what I thought I would want in terms of my healthcare if something should happen in the future. We talked about what sorts of things are important to me and what I prefer, what sorts of interventions I would want in a hospital, etc. And I did it in a very casual, fun way. Actually, all three of us completed our advanced directives that night, and we witnessed for each other. So it's not something that has to be scary or heavy. It's something that can be just a part of making sure that you've got plans in place for the future and that your loved ones and the important people in your life know what you want. When we're looking at finances, we want to consider our current resources, but also think ahead about future costs, right? And that might be things like personal care supplies or residential care or adult day services, but it also can be stuff to help you stay comfortable and safe at home. Maybe there's some home modifications that you might want to think about doing to make it safer and more pleasant for you to be at home for as long as possible. And also think ahead about medical care, right? Where's your medical care going to come from? What are some of the costs that might be associated with that? When we're thinking about our financial resources, of course, a lot of that is going to be around our income and savings, but also in the United States, there are tax deductions and tax credits available for caregivers, for people who have dependents, and for certain medical costs. So if you are in the US, I would recommend taking a look at the AARP tax assistance website. They provide free assistance, even if you're not an AARP member, anyone can access that. This is just a little spreadsheet to help you look at what sorts of things in terms of legal plans to put in place and a tracker so that you can say, okay, this is the last time I updated this. When we're talking about medical care, and again, this is US based, but there should be equivalents for most of these things worldwide. We want to be thinking about the fact that if you are facing familial Alzheimer's disease, you are more likely to be younger when you are experiencing symptoms. And so some of these services that older adults might use might be a little bit harder for you to access. First thing we're going to talk about is Medicare in the United States is for folks over 65 or folks who are under 65 and have been receiving Social Security disability income for at least 2 years. If you are younger than 65, it may behoove you, if you've been working long enough, to apply for SSDI earlier in order to get those Medicare benefits earlier. Medicare pays for a lot of doctor's fees, some outpatient care, hospital care, and some prescription drugs, right? Medicaid, in California, it's Medi-Cal. Every state has their own program. It's an income-based insurance program. SSDI and SSI are both payments from the Social Security Administration. So SSDI would be if you have worked and paid Social Security taxes versus SSI is if you just have financial need and you have a disability. And then these other ones, COBRA, disability insurance, and life insurance, all often come through your employer. I wanted to mention life insurance on here because actually a lot of people are able to access their life insurance as an asset. So if you have life insurance, you may be able to either take a loan from it, borrow out of it and pay it back, or there's something called the accelerated death benefit, which sounds a little bit intense, but all it means is that if you have an illness and you're expected to pass away within a year, you can use some of the money from your life insurance now for your care instead of having to wait. There's also riders for life insurance where if you have a chronic illness, a disability, or a life-limiting illness, they will waive your premiums, so you don't pay those premiums anymore. So those are all things to think about. I mentioned applying for SSDI early, and that is through a program called Compassionate Allowance.
There is a Compassionate Allowance initiative in the USA, which basically means if you're younger, you can apply through Social Security to get those Social Security benefits early. And that's really important for folks with any kind of younger onset Alzheimer's disease or familial Alzheimer's disease, because you may want those benefits sooner, so that you can focus on living your best life and not trying to go through paperwork and appeals process, right? We want to make sure that you get what you deserve and that you're able to move on from that quickly. Some people may decide that they want to continue working longer in order to make more income and save for the future. Some people might decide that they want to retire earlier, or that they want to really spend time at home and with family and not be working. And there's no right or wrong answer to that. But for people who are working and want to stay working as long as possible, there's a couple things to think about. And one of those things is, when do you say something to your workplace? When do you mention something to your employer or to human resources, right? And so it's important to think about when is the safest time and the best time to do that. Your job tasks might become more difficult early on, or you might be able to do your work for a long time pretty easily. And as long as you're able to accomplish your job tasks, there's no reason you shouldn't do them. I know someone who was working at the time that they started experiencing symptoms, and they'd been working for the same company for 20 years or so, and they had the same job for about 10 years. And they were able to keep doing their job, which was an administrative job, with the help of some extra tools. They had an assistant who helped them with their calendar. And so they were able to keep going. But over time, she started to notice her symptoms were increasing, and it was getting harder for her to make it to meetings on time. She noticed that she was repeating herself sometimes when she was giving presentations. And at that point, she went and spoke to her employer, and she said, I'm having some changes and I might need some modifications. I need some accommodations in my work. And because of that, she was able to ask for accommodations where, for example, she didn't give live presentations anymore. She gave all her presentations on Zoom so that she could read her notes really easily. She got extra reminders to make sure that she made it to meetings on time. And she had someone share notes with her after the meeting so that she could keep track of what was going on. So these kinds of modifications let her keep working in her job that she really loved a little bit longer, which was also helpful, of course, for saving for the future. But for her, a big part of it was that she loved her job and she wanted to keep doing it as long as she could. So you want to be thinking about, what are the really essential functions of your job? What are the things that have to be done versus the things that have been added on? What's easy to do versus what's too hard to do now, and what kind of things would help you succeed. If you have a job that's really fast paced, are there tools like calendars and things like that might make it easier for you? Even if you, as a person with Alzheimer's disease, are not working anymore, your loved ones, like a spouse or family members and friends that are supporting you, might also still be working, right? And so there's considerations and protections for them too. They should consider whether they need to be taking time off to maybe go with you to a medical appointment and help take notes. They might look at some flexible work options. Like they might ask if it's okay to switch to a hybrid work schedule or maybe do more remote work. And in the United States, in most places, they would qualify for leave, including intermittent leave. So some people take leave from work in a big chunk. For example, they say, I'm going to take 3 months off of work to help my loved one with this illness. But there's also intermittent leave. And intermittent leave might be on Tuesdays, I need to leave work at noon. And on Fridays, I don't work at all, right? I have this intermittent leave. It's really important not to make any employment decision before you find out about all the benefits that are available to you. One of the things that can be a risk for folks who are working and experiencing memory loss symptoms is that if they don't disclose their symptoms and their need for accommodations, they might be terminated for performance reasons, right? Whereas if you disclose your need for accommodations and you disclose that you have a disability, you may be protected, right? And that means you might be able to keep your disability plan, keep your leave options, and all of that. You will have more options if you talk through all of that first with whoever manages your benefits. And the last thing I wanted to talk a little bit about, and this is something that I think there's no one right answer to, but what about safety and living situations and making the best choice you can to balance your safety, your independence, and your happiness, right? Most people who are living with Alzheimer's disease are living in the community, in their homes, supported by family, friends, and neighbors. So certainly many people would prefer that, right? And so there's a lot of things to consider, like, how do I know that I'm safe at home? How do I know when it's time for someone to be with me at home? And what modifications can we do to keep things as safe as possible? For example, I was speaking to someone really recently whose loved one lives alone. She doesn't cook with the stove, but she does use the microwave every single day. And sometimes she will accidentally put a metal spoon in the microwave, which we know is dangerous, right? And so this woman asked, is it time that I should talk to her about not using the microwave? And we talked it through and we decided instead, what if we just replaced everything in the kitchen with things that are microwave safe, right? Then she can continue to have her ability to prepare her own food, keep that independence, eat what she wants to eat instead of having someone bring things or prepare things for her, and it's still safe. So it's not a black and white thing. There's lots of things that can be done to prioritize what's most important to you, whether that's being able to prepare your own food and have the things that you want, whether that's being able to get out of the house every day and exercise, right? If you need support, perhaps around making sure that you can go to the gym every week because you really love your Zumba class and you want to keep doing that, even if it gets a little bit more difficult for you to get there. These are the things to talk about with family. How do we keep things safe and as fun and productive as possible, both at home and away from home? It's not a bad idea at some point to go visit some residential or day programs and just say, hey, what would you do to accommodate a younger person? What kinds of things would go on? How can I make sure that I have the music that I like, the food that I like? What is the process if I want to go out to a baseball game with my family and I live here, right? So asking those kinds of questions now is totally appropriate, and it's totally okay to ask that. And then I just want to remind everyone as we conclude here that no decision has to be the final and permanent decision when we're talking about future planning. We can make changes over time as needed. We can change what has to happen now and then make more adjustments as more things are needed. There is time to plan and there's time to modify. And so with that, I will go ahead and turn it back to Alicia.
Thank you so much, Vanessa. That was awesome information. I was taking lots of notes there. Jessica, do you have any things to add with what Vanessa said? I always feel like you're so prepared and thoughtful on your journey.
I appreciate that. I don't always feel that way. I'm not sure I have a lot to add. The things that I focus more on are the day-to-day activities and things that I can do to, you know, make memories, whether it be with my husband or my children or just in general, things that you put off and you put off because you're working or you don't want to take the time or you're too busy or I have this going on, I have that going on. And it's really more of a forcing yourself to slow down and take the time to do the things that I hate to say you want to be remembered for, but basically things that you want out there when you're gone. So those are the things that I focus more on.
Yeah. So maybe we should transition to that. But I guess before we do, Vanessa, I guess I had one more question. In advanced directives, there were some details that I thought was really rich. Just this idea of making a plan of how I want somebody to take care of me, like my loved one. I know it seems obvious, but even for my kids, like what food do I want to eat? They know that I like to eat certain things. Or how do I want to dress? Like I want to get into pajamas or not. And Vanessa, could you speak to that? Because I saw that on your chart, but I didn't hear you say it.
Yeah, absolutely. The actual advance directive is a legal document and it's meant to have your care needs, right? What sorts of interventions you would want, what sorts of care you would want. And it's okay to fill that out with things that are important to you about your day-to-day life. And it's also okay to sit down and think about supplementary information that can go along with that. Sometimes we think about this as sort of writing our life story. And what do I like? What is my history? Who are the people that I like to be around, right? Writing all those things out. And I think that perhaps ties in a little bit to when we're talking about making scrapbooks and making photo albums. That can be a part of this, right? Our future planning doesn't have to be all feeling like we're in like a legal or financial meeting. It can also be enriching and bring closeness. For example, in my documents, I have written some things about the food that I want to eat. I have written some things in mine saying that I don't want to be woken up in the morning until I'm ready to get up. So it says, don't wake me up at 6:30 in the morning. I have some things in there that say, I want to be dressed in a certain way. One of the things that I have talked to people about is things like the way they want their hair styled. I think I shared this with you, Alicia, that when I was a memory care director and an executive director, I had a client, a resident, who it was really important to her to have a blowout every week. And so we would blow out her hair and put it in rollers every Saturday. And that's just part of what we did for her because that was part of what made her who she was. That's why I said, make sure you set aside time to have these conversations and to really be honest and engage and think about what's important. Try to think about yourself and how you see yourself in the future and tell people so that they know. My grandmother has really thin hair. And so she always wears a hat. And we all know that. But when she moved into a different living setting, that's something that we had to tell them is when she goes out for a walk, if she goes out to lunch, if she leaves the bedroom, she wants to wear a hat because she doesn't like her thin hair to show. Letting people know us is an important part of this planning.
Yeah, in telling your story, I remember my mom in a nursing home and I'd come to visit and I just felt like they didn't brush her teeth enough. And I wish they brushed her teeth more because I felt like it was very uncomfortable for her the way actually even her lips were, like they seemed chapped. And I wish they applied chapstick and brushed her teeth. I think this general hygiene that gets lost is something that needs to be included too. But yeah, thanks for sharing that detail. It reminded me of that.
Yeah, my pleasure.
So I guess let's move to creating this space where we can bring our beautiful faces in here and be in community with each other.